Thank you for joining us, everyone. Welcome to the Scoliosis Dialogues and SRS podcast. Today, I'm really excited to be able to present to you our Whitecloud Award winners from the IMAST that was in Miami, Florida just a week ago. Again, this award is named after Dr. Thomas E. Whitecloud, who is one of the co-founders of the IMAST meetings. And these awards are given to the best clinical papers, as well as the best basic science and translational research papers. I'm Dr. Ryan Fitzgerald. I'm joining you from St. Petersburg, Florida. I'm part of the Children's Orthopedic and Scoliosis Surgery Associates, associated with Johns Hopkins All Children's. I'm also honored to be joined today by my co-host, Dr. Kariman Abelin-Genevois, who's the head of the orthopedic department and scientific chief officer in Lyon, France.
Hello, Ryan. Thank you.
So let's go ahead and get into it, because we find that these things end up running out of time. First, let's start with our clinical paper. So this paper today, we're going to be joined and talking to Dr. Carreon, and the paper was titled Randomized Control Trial of Instrumented versus Uninstrumented Posterior Lateral Fusion for Lumbar Spondylolisthesis. Dr. Carreon is joining us from Louisville, Kentucky, where she is the clinical research director at Norton Healthcare with the Norton Leatherman Spine Center. Dr. Carreon, welcome. Thank you for joining us.
Thank you.
Can you give us a little background about this paper and this topic? Can you give us a summary?
Yes, so I started working with the Spine Center in the University of Southern Denmark in 2014. And I've noticed that for them, their standard of care for patients who are older than 65 for posterolateral fusions, they were all doing non-instrumented fusions. The rationale being they thought that those patients would have a higher revision rate because of poor bone stock, that the incidence of a screw pull-outs would be high, and that they didn't want to lengthen the operative time by putting instrumentation in. So they had no scientific or evidence-based reasoning to do this, but that's what the standard of care was since they started doing spine surgeries. So I was wondering why that was, when in fact in North America, we do a standard of care of instrumented posterolateral fusions. So this is what led to this study, looking at randomized clinical trial of instrumented versus non-instrumented fusions in patients older than 65 with spondylolisthesis. Luckily, we are able to do it in Denmark. You can do this study in Denmark. It might be difficult to do in North America, but yeah, so we're really, really happy with the study.
But Leah, about the reason why they are performing non-instrumented fusions, do you think it's something more related to the Nordic countries and the standard of care, because they didn't have enough proof that having instrumentation or non-instrumentation would make any change for those patients for the first compression and required to release the nerve roots in that cases?
Yeah, so that's like outside of the scope of the paper, right? Because there were a couple of papers looking at decompression alone versus decompression plus fusion. So that's not what we were looking at. We were looking at, but you're right, because there's no clear, strong evidence that instrumentation improves outcome over non-instrumented fusion. I think that's the barrier to implement certain procedures in Scandinavian countries, especially since it's a socialized medicine.
Exactly. So in this trial, you showed there were no differences in patient-reported outcomes between patients who had instrumented versus non-instrumented, while there was a difference of reoperation. How does it come that there are no differences in patient-reported outcomes, as there are differences in terms of outcomes, general outcomes?
I think, and we're seeing this across all spine fusion studies, I think the 2-year follow-up data point is probably still too early, and we're going to start to see them coming apart as we look at the 5 and 10-year outcome. So that's what we're seeing with some of our other prior studies with non-instrumented fusions as well. If they don't have a solid fusion, their ODI, their outcomes actually start to get worse at 5 and 10 years. So I think at the 2-year time point, it's still going to be, they're starting to come apart, although they're still not statistically significantly different. But if you look at, so we're the follow-up study for this one is we're looking at the cost effectiveness study. And if you look at that, then we're going to be able to show that even at 2 years, because of the higher reoperation rate, even with similar qualities, your cost effective, your instrumented fusions are going to end up to still be more cost effective than the non-instrumented fusions.
And for everyone that's listening, the difference in reoperation for your 2-year time frame was 11% for the uninstrumented group and 2% for the instrumented group. Is that correct?
Yeah, it's actually 13%. I'm looking at the paper right now. It's reoperation at 2 years, like 13% versus 2%.
And do you know, Leah, from the other studies, what would be the rate within 5 or 7 years in these patients? Do you think it's something that is going to increase gradually?
I think so. The reoperation rate, yes, I think so. Because most of the time, like the early reoperation rates are mostly for recurrent stenosis at the index level. And then probably we're going to see more patients with non-unions that start to become symptomatic. Because like these patients, you know, theoretically they're 65 and they have less physiologic load. But I think that thinking is now outdated because we know like 65 and 70-year-olds are now more active than they used to be.
Yeah.
How do you think that this affects clinical practice going forward? Do you think, and what do you think the next step other than continuing to watch them is? Do you think it'll change the way that they do surgery in Denmark? Or do you think that potentially we can, instead of having it be 65 or 70, like you just said, that we can see that there's a cost benefit, not enough of a reoperation rate that if we're taking care of this for a 75-year-old or 80-year-old, that maybe that's an age cutoff for us instead?
Yeah, I think so. I think that age cutoff is going to, you know, go further and further, but then it becomes, as you go, especially in the Scandinavian countries, as you go from, once they start hitting retirement age, then it's harder to show cost per quality improvement because they don't, like the cost will become smaller because they're not, you don't have indirect costs anymore. It's harder to show that. So we try to show that in patients with stenosis who are like 70, but we haven't been able to, you know, we have to think about, to really think about the cost piece in the older group.
Yeah, Leah, you are doing something very special in Denmark. I think it's important to emphasize that, the fact that you are collaborating with them since 2014, you said, going there multiple times. Maybe you can tell us how many times you go there to help with the research projects. And the effort that you created with Mikkel Andersen is just fantastic for all these PhD students. Could you tell us a bit more about this program?
So Mikkel Andersen, who's part of the University of Southern Denmark, we work in a small hospital called Lillebælt Hospital in the middle of Denmark. So since 2014, we've had several PhD students who have really produced a lot of good work. And I think it's gotten to the point that we're actually getting students not just within Lillebælt, within the University of Southern Denmark or within the southern region of Denmark. So we're now coordinating and have PhD students even in Aarhus, which is up north, or in places near Copenhagen and Kuhl. And we're able to work with a lot of the PhD students so we have a lot of PhD students who are not initially affiliated with us, but we are able to help them get their projects going, find funding, get the appropriate study design, and, you know, increase the scientific validity of all their studies. So it's been really, really gratifying for me to see that program grow and spread and be able to help not just our center, but, you know, the Danish spine community as well.
It's wonderful.
Absolutely. I think that really kind of gets at one of the missions of SRS. You know, this is not just an American-based society, as we can tell by the people that are on this call. And I think the international collaboration truly is helping spine patients from around the world. So thank you again for all of your work on this paper.
Thank you.
Any closing remarks for our listeners in regard to this? Obviously, in regards to an achievement, the Whitecloud Award is very prestigious. Where does this fall on your bucket list, on your rankings of accomplishments?
Yeah, it's a great honor especially for Denmark, especially for Andreas, who is the PhD student, who's the first author for this particular paper. It's the first paper out of our spine center that got the Whitecloud Award, and I'm really, really, really proud of that. Yeah, so now I think it gives us more credibility, and we're starting to do a lot more multi-center studies within Denmark and even outside of Denmark.
So now we are welcoming Dr. Jian Cao and Jie Li, who are both awarded by the Whitecloud Award for the Basic Science. Their paper is titled The Role of Vitamin D Deficiency in the Onset of Adolescent Idiopathic Scoliosis, a validation study on bipedal mice model. And this is a collaboration between first Dr. Cao, who is working actually, maybe you can introduce yourself. You are working in Robert Wood Johnson Medical School in New Jersey. And Dr. Jie Li is working in Nanjing with Professor Jian Cao in University Hospital, who is dealing with a lot of idiopathic and non-idiopathic scoliosis with severe cases, which is a huge center with a tremendous experience in adolescent idiopathic scoliosis. So please first maybe introduce both of yourselves.
Sure. So my name is Jian Cao, and I'm an assistant professor at Robert Wood Johnson Medical School, Rutgers State University of New Jersey. So I'm a basic scientist. I don't do a scoliosis study. I do majorly cancer, but I participated in this study. So this study is done by our team in the Jian Cao Hospital in Nanjing.
What was exactly your role in this study? Which part did you perform?
I majorly provide suggestions and comments as a basic scientist. So myself is not doing a scoliosis study, but I'm personally a very good friend with the first author of this paper. We know each other from high school, so we keep close contact. And when he's a doctor, clinician, surgeon, so when he's doing some basic science studies, so he always discuss with me. I try to provide some suggestions. That's how I involved in this study. And because of the pandemic, the research team cannot travel to US. So that's why I presented this study in the conference.
Okay. So what about Dr. Jie Li? Can you tell us a bit more about you? So you're a surgeon, assistant professor, I heard, MD and PhD. So you're working in Nanjing.
Yes, sure. Nice to meet everyone here. So this is Jie Li from the Nanjing Jian Cao Hospital, which is the affiliate hospital of Nanjing University Medical School. And currently we are in the scoliosis research and also the clinical treatment center led by Professor Jian Cao. As I said, I am currently a PhD student, but I have already got a MD degree. So I would like to attend this podcast, and which is also on behalf of my supervisor, which is the first author of the paper, Professor Zhen Liu. For my next plan, I will also study a postdoc study also on the scoliosis research, and I'm interested in the study in both the basic and also the clinical study related to the etiology of spine deformity.
Thank you very much.
Thank you for the introduction. Could you do us a favor, Dr. Li? Could you go ahead and give us a synopsis of your work and this Whitecloud Award-winning paper?
Do you want me to introduce? Because I did the presentation.
Yes, absolutely.
With pleasure.
Okay. So yeah, this is a very straightforward study. So basically, we did a proof of concept study in animal to show that vitamin D deficiency contributed to scoliosis. So basically, we used a bipedal mice model. We generate this model. It has been well established. Some of those mice will develop scoliosis similar to human. And then we treat those mice either with normal diet or vitamin D deficient diet. And in other groups, we add additional vitamin D. Then we monitor the scoliosis development. What we found was that when withdrawal vitamin D from food, those mice develop very severe scoliosis compared to the control diet. And providing additional vitamin D largely prevented severe scoliosis. So that's a major finding from this study.
So would you say that in this bipedal model of mice, you had some scoliosis even when they had a normal diet with vitamin D?
Yes, correct.
Did you have a special protocol for light exposure for these mice?
Yes, I would like to answer the question. So actually, we are keeping the mice with the standard protocol. I think it's a 12-hour light or 12-hour nighttime. So I think it's a standard protocol with the as we keep the mice in a general experiment.
Okay, and where were located the curves that you found? Were they different types of curves? Did you find always the same types of curves? I mean, thoracic or thoracolumbar? The question is really which kind of curve did occur when you looked at the mice on the X-rays? Were they in the thoracic area, thoracolumbar, lumbar, or did you have different kinds of curves?
Thank you. And actually, I think based on our observation, most of the curves are located in the thoracic region. But I will have to say that when we are taking those X-rays on examining the scoliosis, we do find some kind of a tilt or some kind of the curved tail of the so-called the thoracolumbar region of the mice. But still, we believe that if you claim a scoliosis at the thoracolumbar region, it can be due to posture or can be due to the way you put the mice in the machine. So I think it's when the scoliosis are located, and it's also what we have observed. If the scoliosis is presented in the thoracic region, and because the thoracic region is restricted by the thoracic cage and also the ribs, so we will have to say it's pretty much a structure scoliosis. So we believe our findings are solid.
Did you see rotation in the vertebrae of these mice? Were they turning?
Frankly, we did not observe a very large rotation because rotation it's usually happened in thoracolumbar scoliosis for the clinical patients, and additionally we do observe some kind of kyphosis, which is present with the scoliosis, but not the very typical rotation as we observe in patients.
I noticed that in your G1 group, which was the group that had lower vitamin D levels, serum vitamin D levels, that the trap staining, which is the staining that basically shows osteoclast activity, was much lower. And so do you think you can extrapolate anything from that? Are we saying that the scoliosis is being made due to bony changes prior to soft tissue changes, or are we unable to make those references based on it being vitamin D only?
Thank you. And I think based on our preliminary observation, and we would believe that in our story, the vitamin D would induce the scoliosis by the activated osteoclastogenesis, which is the increased number of osteoclasts in the trabecular bone in the vertebral region. I think it's this is, and also we on micro-CT, we have identified some kind of the related structural deterioration of the trabecular bone, which is the 3D structure, and with the deterioration of the structure, we may assume that the mechanical strength of the bone will be altered in some way. So this can be some kind of a predisposing factor for the development of scoliosis. But as this study is also ongoing, and we will try to find out more, say, specific molecular mechanisms related, as you have kindly mentioned or found in the literature, and perhaps the cartilage end plate, and also the central nervous system, which can also be potentially involved in this, because vitamin D has a lot of systemic biological functions, so remains to be defined.
Exactly. Yeah, vitamin D is more like a hormone. It's also regulating some of our genes, related to activation of some estrogen-related genes. So there are many pathways that you can explore with this vitamin D. But looking at the cartilage and plates, even though it's very different between mice and humans, did you see something that could help to understand if it was more related to differential growth, or if it was really the bone that was deficient in this case?
We do harvest the samples of the both the long bones and also the trabecular bone. As we know that there is the clinical disease called rickets. You know, when there is rickets, there is the vitamin D deficiency and sometimes very severe. And the mechanisms of rickets is that, you know, when you lost vitamin D, the lost some kind of the cartilage growth or the end plate or the growth plate growth, I would say especially in the long bone, in the metaphyseal region of the long bone. So I think in our story, it would be quite different because we are not idiopathic scoliosis is quite different from rickets. But I would say that based on our current finding, I wouldn't say that we have found any solid evidence or changes on the cartridge. And yes, we'll take this suggestion and surely try to, you know, identify if there is any changes in the cartridge, especially the growth plate and the vertebral region, and try to see if there's any difference.
Yeah, because you know, the cartilage end plate in mice is really close to our physis and epiphysis. So there might be something to explore in this area to see if it's acting on this area like we see in rickets and long bone deformations that we have, or if it's really something that is acting in another area. I know it's very difficult to show, but it would be interesting just to know if it's through this pathway or if it's something different, and then it's really answering the question of AIS.
So I think one of the advantages of being here with two Whitecloud Award-winning papers is that we have Dr. Carreon, which after being SRS meetings and POSNA meetings for the last decade, I know she often asks wonderful questions.
I don't think they're described as wonderful by most people.
I think that they are thoughtful questions and challenging questions, which is why I appreciate them, especially when I'm not on the receiving end of them. So I was wondering if you had any questions for this paper.
Yeah, I was wondering why you had, I mean, it may be something about the animal model itself. Why did you use all males and no females when we all know that scoliosis in humans is mostly, there's a preponderance of females?
Yeah, thank you for your question. And actually that's very critical, and that's related to our experimental design. So I think clinically this is a prevalent disease in the female, and we would like to see that when we consider design the experiment, we also consider the when we study the female rats, we'll have to consider the role of estrogen, perhaps. I think so. And as we know, the biological function of vitamin D, there would also be some kind of interaction with vitamin D, or so this can potentially be an confounding factor of our experiment. So we designed to validate the vitamin D deficiency and also supplement and in the male mice. And we can do both actually in a further experiment to validate that.
So Dr. Cao and Dr. Li, what do you think that the next step is with this research? How are you going to apply what we've learned from this and move forward? Do you think that there are translational opportunities? Do you think there's another animal model you're going to try this in? What would you like to do next?
So for the research part, I think one critical experiment that we are going to do is to see when vitamin D deficiency actually play a role in scoliosis, in an early time or in a later time. So another word, if scoliosis already initiated, if we provide vitamin D, will it prevent further development? So we can answer this question in this mouse model. That's something we are planning to do. Currently in this paper, what we did was to give vitamin D deficiency from very beginning. right before the bipedal model. But in the future, we are going to test withdrawal or providing vitamin D at different time points to see when it played the most important role. That's from the experiment aspect. So maybe Dr. Li can answer about the clinical practice.
Overall, I think based on both the clinical and the preclinical findings, the important role of vitamin D in development of scoliosis is idiopathic scoliosis is confirmative. So, but I would say that for clinical translation in real practice, I would say that based on current evidence, we cannot yet jump to the clinical recommendation. Because we think there are, for example, there are a few questions to be answered, including the indication for supplementation, such as, we should perform the supplementation with those deficiency patient only, or those with insufficiency patients with idiopathic scoliosis, and also the earlier diagnosis patients or those who have reached the skeletal maturity, and also the dosage of vitamin D, or whether we should apply that in combination with calcium or not. And here, I would like to mention that there is an RCT trial which is conducted by our collaborator, because we have our Nanjing University, Drum Tower Hospital. We had a joint scoliosis research center with the Chinese University of Hong Kong. And our collaborators there, Professor T.P. Lamp, has conducted the RCT trial on this. He combined the vitamin D and calcium supplementation, and has the very promising finding. Confirmative findings show that such combination can hold the scoliosis progression. So to conclude, I think we are, especially our team and also our joint efforts from our scoliosis research, joint scoliosis research center with the Hong Kong team, we are trying to make a continuous effort to solve these above mentioned potential questions, and start the clinical validation by the multi-center study at a large sample size. So I think the vitamin D, it's available and a frequently used nutritional supplement clinically already. So we believe that this therapy can be applied in the selected patients in the very near future. Thank you.
Dr. Liu, do you consider the fact that there might be some vitamin D resistance? Because we don't always find vitamin D low levels. Patients are not always deficient in vitamin D, but there might be problem with some specific receptors, especially in the central nervous system, explaining maybe why it is so much related to AIS. And then are you in this clinical research trying to supplement patients that even have no deficiency on their biological tests?
I think, yes, currently we are having some kind of evaluation clinically, and because in our center, most of the patients that came to our center are quite severe scoliosis, so they receive the surgical treatment. And for the outpatient clinics, we do have some cases with mild curves, and we do remind some of the kids, if they came to our clinic and showed rapid curve progression, then we would recommend such examinations like BMD checking or vitamin D checking. And meanwhile, we also suggested both the surgically treated patients and also the patient at the outpatient clinic. We suggest them to take an active part into the outdoor activities and to ensure them have a lot of sunshine exposure. I think that's also very important to contribute to the overall functional well-being, and also also contribute to the bone health. So, but so far we are not like supplement vitamin D for all the cases, because if someone has the children with AIS, he has very normal BMD and also very normal vitamin D. I don't think that sometimes too much vitamin D is also not good.
I want to add that so we did find some associations between SNPs in vitamin D receptors and AIS. We had previous publication on those topics. That's something we also need to be to consider in future, because in those patients, providing vitamin D alone may not be sufficient, even they have deficiency on this pathway. right? So that's need to be considered.
Yeah, very true. Thank you.
And sorry, and I would like to make one supplementation, is that actually we have been started an additional study on the role of microbiota and vitamin D, because it really kind of related to the intestinal function or calcium resorption kind of mechanism. I think it's perhaps one of the potential mechanisms related, but to be defined.
Thank you very much.
Thank you guys all for joining us. We had the Whitecloud Award-winning papers and their authors join us today. Really a lively and fantastic discussion. I think that this is really pushing the science of medicine forward. I appreciate everyone's time today. Again, thanks for joining us for the Scoliosis Dialogues and SRS podcast.
Congratulations again to both of you.
Thank you.
Thank you.
Thank you for having us.
Thank you very much.
It was really a pleasure, and thank you for all the answers you gave. It's very interesting, and it brings a lot of questions, but I think that's why it's good to go deeper in this topic. Thank you so much.
Thank you.
Thank you.
The Scoliosis Research Society is a nonprofit professional organization made up of physicians and allied health personnel. Their primary focus is on providing continuing medical education for healthcare professionals and on funding and supporting research in spinal deformities. Please visit srs.org for further information.